name is Dr. Rosas, and today we're going to talk about Candida. Candida is also known as candidiasis, and it's a fungal infection caused by yeast overgrowth that usually resides in the intestines and can also manifest in the throat, the mouth, and the skin. Some of the more obvious symptoms may be abdominal pain, gas, bloating, skin reactions, also fatigue. Some other lesser known symptoms may be headache, sinus congestion, pain or pressure, brain fog, recurrent yeast infections, as well as a white kind of thick layer on your tongue known as thrush. So those are some other symptoms that can present. Yeah, there's lots of things that can cause Candida. So food intolerances, micronutrient deficiencies, heavy metal toxicity, underlying chronic infections. So it's really important to kind of do a thorough case history just to really kind of figure out what's the cause of your Candida overgrowth. Because it can present differently in all individuals. So that's going to be pretty key. A lot of patients won't come into the clinic to address their underlying issues until they've had this infection for maybe years. They may not even present with symptoms until, they start really feeling detrimental in their health. And so it's really important to kind of address the cause too. So I think that's also what's tricky about Candida is that depending if it's due to heavy metals or hormone imbalances, blood sugar dysregulation, etc., you really kind of have to tackle it from a holistic approach to be able to really decrease their symptoms. Yeah, so there's different ways of testing for Candida. So you could do a blood test to look for Candida antibodies, so for IgG, IgM, IgA, and you can also do a stool analysis. A comprehensive stool analysis will also be able to look for any, digestion and absorption deficiencies or abnormalities, inflammation going on in the gut, any dysbiosis that may be causing the Candida as well. So you can look at that as well. Yeah, antibiotics can really strip out a lot of the good bacteria in your gut and kind of harbor an environment for Candida to take over the GI system and cause Candida overgrowth. So if you're someone who's using high-dose antibiotics or have had a history of using lots of antibiotics, we'll definitely like to address that to see if that's the cause of your yeast overgrowth. Yeah, there's lots of nutrition and lifestyle factors that can help keep your yeast overgrowth at bay and kind of help decrease it systemically. So in terms of nutrition, we'll work with patients to guide them through a Candida type diet, which can be tricky, but we'll work with our patients kind of one-on-one, but that's kind of key there. We're removing, any underground root type vegetables, removing sugars, alcohol, dairy. Those are kind of like the top ones to avoid, but then there's a list of other foods that are pretty uncommon for patients that can cause more yeast overgrowth. In terms of lifestyle factors, really depending on what's going on with the patient. So stress can really cause dysbiosis and yeast overgrowth. So managing adrenal health, managing stress, as well as exercise, making sure we're able to detox through sweat and exercising regularly. So yeast overgrowth can really take a long time to tackle and kind of completely get rid of in the system. So that's something we really like to let patients know. Sometimes patients will go see their conventional doctor and they'll prescribe, an antifungal medication like ketoconazole. And then usually it'll work for the time being, short term, and then they'll come back a couple months later saying, oh, I have this recurrent yeast overgrowth. And so usually with antifungals, from a pharmaceutical perspective, it could really cause resistance for the yeast. So it's important to tackle kind of the underlying cause of the yeast overgrowth, whether that's blood sugar dysregulation, tackling diet, that's going to play a huge role. Really kind of being diligent and strict just for the time being. Just know that this is for your health to improve in the long term. And once you're sticking to the diet and the treatment protocol, you'll see great improvements. And we do see that here in the clinic. So sticking to the Candida diet protocol, as well as following any supplements in addition to, so some really great herbs that can be helpful, like berberine, oregano, black walnut. So it'll be a very comprehensive plan, not just diet. And other things that make yeast overgrowth hard to kill off include biofilms. So a lot of times we do like to work with patients who have chronic recurrent yeast infections, is getting rid of that thick biofilm layer that's lining the intestinal lining, which makes it a lot harder for yeast to eradicate from the system. So if you're someone who's presenting, with symptoms of abdominal pain, headache, skin conditions, recurrent, yeast infections, things like that, it's important to go ahead and give us a call because we can address the underlying cause of your condition, and we're excited to work with you.